One of the three ways that I get thoracic extension, either for testing or treatment, is in supine, lying over a fulcrum. The other two ways are in sitting and in prone lying. But the supine version I do use quite often, and when I have patients use a fulcrum, what I use in the clinic is a half foam roll. I use the firm density. I find that people can tolerate this. You can use other things, of course, like water bottles or tennis ball holders. I've been creative with people for their homes, but these are inexpensive and usually quite accessible to people. So when I use the half foam roll, I place it under the level of the thoracic spine, the specific joint that I want to target, and I have the patient lie flat, meaning legs straight, arms straight, and head on the floor. Now, if the head cannot reach the floor comfortably, likely because there's a mechanical disruption or just lack of mobility in the upper thoracic spine or the neck, I can have the patient use a small pillow, but I only want it to be enough so that it's comfortable. I don't want to increase the flexion angle of the upper thoracic spine or neck with pillows. And I do give the instructions that you can start with a pillow or a folded up towel, but if you can handle it as your body gets accustomed to this position, I want you to take that away as much as you can so that ultimately, if possible, your head is flat on the floor. So this would be under the patient, of course, perpendicular to the patient. Now, this is 3 inches in height. If I want to make it a little bit taller, I might fold some towels like a washcloth and put it under the roll and slowly increase the amount of height there, thereby in theory increasing the amount of intensity in terms of that fulcrum into extension. But I don't really use a full foam roll because I'm not getting that specificity with the joint into end range that I want when we increase the angle that much. So make sure the body is straight. We don't want the knees to be bent. We don't want the neck to be bent up a lot. And then use something firm. If you're not getting it at the right level and you don't see a change on the baselines, you may change the position of the half foam roll up an inch or down an inch. You can increase the height. And when I start out, again, it depends with testing on the patient's presentation, but I usually start at 30 seconds to a minute. And if that's not fruitful, I may look at more time. For some patients, it does take quite a bit of time in this position. Again, the thoracic spine is built for rigidity, so more force, either through actual force with external pressure or more force via more time, is usually indicated for testing of the thoracic spine and treatment of the thoracic spine when it comes to mechanical joint arrangements.